Hi, my name is Christy, and I want to share a story that might be helpful to other people who may be in the situation that I was in. About 3 years ago, I had some health issues, and I did a fast trying to correct some of those issues. And after the fast, a lot of those symptoms got incredibly worse. And I had these severe panic attacks that I can't even describe to you. I was delusional, and I got super depressed, and the high level of anxiety that I've never known before, and really thought I was losing my mind. And I went to 8 different doctors. We were desperate trying to find out what the problem was because it seemed that the fast had done something to trigger it. Because my husband kept saying, "You weren't this way, and now you are. Why aren't the doctors trying to figure out what the problem is?" So, doctor after doctor after doctor, basically, I was huddled in a corner, just beside myself, and it was awful. My children had to watch me go through that, and my husband, but we just kept trying to find an answer. And we actually had our elders from our church come over and pray over us. And soon after that, uh, my sister, who lives in Mexico City, was trying to help from far away, and she was doing research, and she said, "I really think you need to get your hormones checked." And I was thinking, well, I mean, I know hormones can affect you, but she doesn't understand the seriousness of what I'm going through. It couldn't be something simple. But we couldn't get a doctor to test my hormones, and so the more I looked into it, I was like, well, yeah, this is sounds like me. So a doctor in another state that I used to go to, she ordered the blood work, and uh, I didn't know how to interpret it because I'm not a doctor. So I walked into how I found this amazing lady was I called my compounding pharmacy here, and I asked them, "Can you give me a list of doctors who prescribe hormones, natural hormones?" And I thought I'd start there. And I walked into her office, and I was just a mess. Like I wasn't functioning. It had been weeks of this, just complete hopelessness, delusional, even a level of psychosis there. And she looked at my labs, and she looked right at me, and she said, "I know exactly what's wrong with you, and I can help you." She said my grandmother was institutionalized whenever she went through menopause. And sure enough, I let her treat me with the natural hormones, and within 2 weeks, I began seeing significant improvements. And I didn't get completely better in 2 weeks, but I knew I was on the right road because I began to improve, and I have improved every day since then. And doing the bioidentical hormones was the best thing for my health that I've ever done. So basically, what she called it was, she said it's similar to someone who has postpartum depression. Your hormones are just so mixed up and out of whack, and when you go through menopause, you have such a drop. And I was young, I mean, young for menopause. I think I'd started seeing some of these symptoms in mid 40s, but my mother and my grandmother had gone through menopause whenever they were 44. So I was 49, 47 at the time. And anyway, she said it's similar to that, and she said it's been referred to as menopausal induced psychosis. And I'm just grateful for her. I'm grateful for all the people who helped me through that. And I just want to encourage, if you have some of these symptoms, and you, even if you're not at the age of possible menopause, at other times in your life you can have hormones that are off or low or unbalanced. And so it's worth going to see a doctor who's got some experience in treating people with hormones, especially the bioidentical ones that are natural and your body recognizes it better. I had doctors who wanted to prescribe me sleeping pills, antipsychotic drugs, antidepressant drugs, anti-anxiety meds. Thus, the cocktails they were handing to me, and I'm so thankful that my husband said, you're not going to take these because they don't deal with the root problem, and we haven't figured out what the problem is. And I mean, I know sometimes people need to have those drugs, but I'm encouraging you that if you do have these symptoms, it's worth getting someone who knows hormones to check them, and they can look at your levels and find out if it's normal or not normal, and if they think that they can help. So I hope this is helpful to you. I hope my story can save other people a lot of suffering and pain and their families. Thank you.